The Minister talks about progress, and she's always willing, and the Government is always willing, to blow its own trumpet. And we saw that, we still see it in the Dáil chamber all week. I don't know if we're going to discuss the spring statement here, but certainly the Minister's speech is in stark contrast to the self-glorification in the Dáil about the spring statement and about how great things are. Because what the Minister describes as progress is a 10% increase in the waiting list every year. Certainly 2013, 2014 and on to now, it seems to be a 10% increase in the waiting list. And the Minister to quibble with figures that I certainly haven't seen. The figures that I have correspond with what the Minister is announcing in terms of the waiting list, with 3,000 children and teenagers waiting to access mental health services, and the Minister thinks this is an achievement. And the opposition given the wrong figures, but these are the real figures. Well, the real figures are absolutely terrible, and they're the figures that I have and the figures that I'm standing over, and the Minister seems to agree with. And far in excess of 400 waiting for over a year, with a fairly wishy-washy commitment to dealing with those in terms of priority. I and my party, and I'm very committed to the whole issue of mental health. I think, in fairness, the whole country is wising up to mental health. But it really is about time that it was taken very, very seriously at the highest levels of government. Because if we're looking for a decent society, a decent country, we will be putting things like this first. We will be trying to deal with young people's mental health problems first, before we start talking about let's spend again, let's have an election and let's try and bribe the electorate, because the public won't wear it, because in all parts of this country there is a lack of decency. Minister Lynch is there as a Minister of State and doing her bit, certainly, but this government does not seem to be committed to this issue, and people in this area and in many other parts of the health service and throughout wider society are falling through the cracks. But the figures are that there are approximately 3,000 children and teenagers waiting to access mental health services in the community. More than 400, substantially in excess of 400, waiting for more than a year. And the waiting lists are going up. And that, as the Minister said, and I quote, "Much progress has been made." Much progress has been made when the waiting list seems to increase by 10% every year, at a time when we realise and we know that there is a national crisis in this area, and a crisis that can be dealt with if we put the resources to it, and perhaps if we change the approach. The demand for services increases, and the Minister gave some unverified information that it may be because people are trying to access other waiting lists. But I don't think she gave any evidence about that. And that's just an excuse, I think. We don't seem to be serious about this at all. We don't seem to be serious about the fact that many young people get admitted to adult wards. And as somebody who's visited, and probably many of us have visited, Senator Gilroy works in that field, or worked in that field, any of us who have visited adult psychiatric wards, they're not very nice places now. They really are not. In fact, you would question whether you bring your own children in to see patients if you're somebody to visit. And I don't think that's discriminatory or insulting to anybody. That's a fact. They're not nice places, and they're not a suitable environment for children to be treated. It's about a third, I think, of all child and teenager admissions are into adult wards. It's completely and utterly inappropriate, and it really portrays and betrays an incredible lack of decency in society that we are allowing to do this. This has been highlighted by the Mental Health Commission, and they have said that this is not acceptable. And I don't think anyone believes that it is acceptable in any way, and yet it still continues to happen. The chairman of the Commission stated, "We're talking about teenagers who may find themselves in wards with much older people in environments that can feel threatening and fearful. They lack the kind of therapeutic input that is the norm in a children's setting." And that stands to reason and common sense. I don't think anybody would need to be a professor of psychiatry or even an expert in children to realise that. it looks like the numbers, the increase is continuing, and it looks like there will be a year-on-year increase again in the amount of children and teenagers admitted to adult units. So there's a lot of problems, and the Minister coming in to criticise the opposition and to claim much progress is not really appropriate in my view. We have developed our own strategy on youth mental health. We've also proposed the establishment of a mental health authority. We feel that it could do some good work when you have a national agency focused on one particular issue. The Road Safety Authority comes to mind. They do seem to have an effect if they're given the budget, if they're given the resources, if they're given the power to be independent of government. They do seem to make an impact. I think that they could play a useful role in tying all of the great voluntary organisations around the country that are working very, very hard, but in some cases, they may do a better job if they're coordinated better, or indeed if they're given more resources to do the job that they want to do. And the reality is that mental health issues, we now know, are a huge issue with the suicide epidemic that's out there. But 1 in 4 students at any given time are said to experience psychological problems. Our policy would greatly enhance the role that our schools and colleges play in promoting positive mental health and equipping young people with coping skills, and indeed many schools do operate effective strategies. But there needs to be a lot more coordination of that, because some schools don't, and that's simply a fact. And some schools have very good anti-bullying policies, for example, and others simply don't. So there needs to be a focus on positive mental health promotion at all levels of the education system. We had a big, I suppose 20 years ago, there was a huge discussion about sexual education and reproductive education and all, and protection, I suppose, for children and vulnerable people as they grow older in the schools, and there was a big controversy at the time, and that's in there now, and it operates at all levels of the education system actually now, and maybe something similar to the structure of the relationships in sexuality education could be brought in terms of mental health, but that strategy doesn't appear to be there, nor the will to do it. Bullying as well, cyberbullying, with a huge emphasis on peer support, and I suppose giving people a way to look around at social media and to know what is and what isn't appropriate, and how to operate social media as well, because some people may be ignorant in terms of that. All schools and colleges, in our view, should have their own mental health promotion plans, with students, staff, parents being involved in the development and implementation of these plans. Now, there is I suppose, an implicit criticism by the Minister that nothing was happening in relation to mental health until very recently, and at the same time she wants to implement a vision for change, which of course was the policy of the last government that we support and we want to see implemented absolutely fully. It is the policy for a future of services in the area of mental health, and we are glad that the government does state that it's committed to it. It does obviously need to be reviewed, and we believe that it should be reviewed. The work should start on that process. But clearly there is more to be done. I would like to see this issue treated with a lot more seriousness. It is totally and utterly wrong that a child or a teenager should be put through the trauma of going into an adult psychiatric ward. It is just completely and utterly wrong. In many cases, they're absolutely horrible places. There's no other word for it. They're horrible places for the adults that have to go to them. And adults have said that, and we've visited them. They're absolutely awful places. But to send them, and that's no disrespect to the staff, because the staff would agree, I'm sure, that these, in many cases, are old buildings with really the old style that we should be moving. We should be moving away from, and there is some work going on. I would like to ask the Minister a question then, if she could answer me about the situation in Navan as well. There's been a lot of confusion in Navan about the move to Drogheda and what's happening and what's staying in Navan and what's going to Drogheda. Maybe the Minister could clarify that, just in terms of the general services.
Senator Henry.